Every mama wants her pregnancy to go as smoothly as possible and her baby to be as healthy as possible. Unfortunately, it is a time of great risk, and that's why prevention is just so important. A nutritious diet optimised for pregnancy can make a very big difference when it comes to preventing pregnancy complications. So today, I'm excited to have a special guest, leading obstetrician Dr. Peter Jurcevic, who will share with us 5 of the most common complications during pregnancy that obstetricians see, so that you can focus on prevention and optimise the health of your little one. Stay tuned. Welcome to Nourish. So I'd like to introduce you to my special guest, Dr. Peter Jurcevic. Welcome, Peter.
Thank you for having me.
Thank you. We are so honoured to have you with us today. Could you start by just telling our audience a little bit about what you do?
Sure. So I'm an obstetrician and gynaecologist, which essentially means I provide healthcare to women and to pregnant women particularly and their babies. I've been working for 27 years in the specialty, and I work in both the public and the private sector. I was trained in high-risk obstetrics, and so I've been very blessed to be able to manage very complicated pregnancies. But having said that, I've been very passionate over my journey in the holistic aspects of pregnancy care, and I've spent a lot of time focusing on active birthing, otherwise referred to as calm birthing, Lamaze or hypnobirthing, with reference to birth preparation to try to improve birth outcomes for women. I've also been very passionate in pioneering the way for maternally assisted caesarean sections for women who need a caesarean section but are looking for a much more connected experience. And really have started to investigate a lot more about sort of the naturopathic, dietetic, holistic aspects of healthcare to improve care for women so that we can balance that medical and holistic approach.
Amazing, and that's why we've brought him on. So, Dr. Jurcevic, today we're talking about common complications during pregnancy. Could you please tell us about the top 5 most common complications that you see in pregnant mamas?
Sure. So, unfortunately, lots of complications can occur in pregnancy, but if you're looking at the top 5, we'd be focusing on miscarriage, we'd be focusing on growth restriction, we'd be focusing on prematurity, preeclampsia or toxemia, high blood pressure, and diabetes, gestational diabetes.
Right, so let's start with miscarriage. It's a big concern to mums. What are the stats and who's at high risk of miscarriage?
Sure. So miscarriage, interestingly, can affect up to 50% of all pregnancies, and people often don't realise just how common the problem can be, albeit that usually refers to the very early pregnancy losses where women may not even realise they were pregnant in the first place. Overall, for women who know she's pregnant, has a positive pregnancy test, it's about 1 in 7, 15%, so fairly common. And if we talk about some of the risk factors for having a miscarriage, certainly the mature age mothers, so a woman who is in her latter reproductive years, say 36 onwards, there can be certainly immunological and clotting based reasons. Women can have issues with their uterine environment, they can have hormonal issues, and certainly from the diabetic space or the dietetic space, there can be certainly issues in relation to your weight and so on, which can contribute.
Right. You also mentioned preeclampsia. So can you go on to tell us a little bit about preeclampsia? Who's at risk in terms of that?
Sure. So the overall incidence of preeclampsia will be about 7% or 1 in 15, and fortunately only a very small subset of that group of women will get it severely, and its severest form, which can lead to organ derangement, fitting, and even in severe cases compromise to both you and to the baby. But the risk factors often, it usually occurs idiopathically, so it just occurs out of the blue.
Right.
But there are definitely risk factors which can contribute, and once again, age contributes, excess weight can contribute, certain behaviours, for example, smoking, etc., which thankfully we see less rates of in pregnancy for the most part, and a number of other particular pre-existing issues, medical issues.
Right. Uterine growth restriction was in your top 5 as well. Who's at risk of that, and what are some of the outcomes there?
Sure. Once again, similarly to a lot of the problems we experience, they often occur de novo and they're unexpected. But risk factors, and again we go back to age, so having your children later in your reproductive years will contribute. Smoking, once again, albeit those rates have dropped. Again, certain pre-existing medical disorders, issues in relation to your immunoclotting system, to name but a few.
Yep, okay. Gestational diabetes was in your top 5. Can you talk to us about some of the risk factors there?
Sure. It's a very relevant topic, in particular in reference to the dietetic space. When I started my training, about 2% of women will get gestational diabetes, but we fast forward to now, 2022, and we're seeing incidence of up to 20% in certain cohorts.
Yeah.
That's a significant increase in that particular disorder just in one generation. Risk factors, certainly starting pregnancy with excess weight would be a potential risk factor. If you've got PCOS, polycystic ovarian syndrome, again, I allude to the issues in relation to advanced maternal age when you're trying to conceive. They would be but a few risk factors, and again, also family history.
And I'm missing number 5.
Yep, so prematurity.
Prematurity.
Yes.
Thank you.
Yeah. So prematurity is all conditions we try desperately to help women to prevent or protect if the particular disease onsets. Prematurity, if you have a baby very prematurely, there are lifelong potential consequences to that child, and so we do everything in our power to try to keep a baby in utero for as long as possible. The incidence will be about 5%, and the really severe cases, say for example under the 32nd week of the pregnancy, are less again. But as a condition, we have thankfully strategies to help to manage if it occurs, but risk factors will include, again, age, again, weight-related issues. There's actually evidence that talks about issues in relation to your dentition, which can sometimes affect prematurity and also growth restriction. So I could spend a long time talking about the multiple risk factors and therapeutic approaches, but definitely it's a condition that we desperately try to protect against.
I find it interesting as a dietitian that when we hear about those most common 5 conditions during pregnancy, and the risk factors are things like unhealthy diets and excess body weight and some of those common risk factors, smoking that you were mentioning, that then really, when you're talking to mums out there in the community, some of their most common concerns tend to be things like listeria risk, which really, you didn't even mention that in your top 5.
Sure. It's interesting, in 27 years of practice, I've seen one proven case of listeria. So most of the gastrointestinal issues that I'll see women experience will be from eating off food and getting gastro, so Salmonella Campylobacter, or getting exposed to rotavirus, as a contagious gastro. So whilst we do encourage following listeria policies in terms of food consumption, example, avoiding soft cheeses and raw fish and making sure that the things you have are pasteurised or properly kept, it's actually very, very rare. So our focus on the particular issues we talked about in terms of those miscarriage, prematurity, growth restriction, preeclampsia, diabetes, etc., there is definitely some preemptive stuff we can do for women who might have risk factors for that. Obviously, we can't change the fact that if you're having your first child at a certain age, etc., or have a pre-existing medical disorder, that is what it is. But please know that we have ways of helping, and dietetics is but one of a number of ways of helping improving women's health.
Amazing. Is there any final messages that you'd like to share with this all in mind?
Sure. Yeah. We have the expertise, we have the growing knowledge to help to keep you safe during the course of your pregnancy journey. There's no question that speaking with a care provider or a dietitian before you start taking appropriate supplements, for example, iodine, folate, iron where necessary, vitamin D if your levels are low. Starting your pregnancy with the best body weight that you can have, and if there are concerns in relation to your diet, to approach that appropriately. If you have a particular pre-existing medical problem, to get that properly managed so that you're starting the pregnancy with that condition under control. And from the point of view of seeing a doctor, a midwife, etc., or having public or private based care, it's just ensuring that you're having a degree of supervision to make sure that you stay healthy during the course of your pregnancy journey to keep you and your baby safe, protect against those problems or manage them if they occur.
Amazing. Thank you so much for sharing all of your knowledge with us today. We really appreciate it.
My pleasure.
As you've heard, one of the best strategies that you can undertake to reduce your risk of complications is to optimise your pregnancy nutrition. And to help you achieve this, I've designed a 7-day pregnancy meal plan that you can download free of charge as my gift to you. Just go to www.melaniemcgrice.com/pregnancy and make sure that you check out some of my other pregnancy nutrition tips, such as the best fish to eat during pregnancy. I look forward to seeing you in my next video. Great. Yep. And then, as you've heard, one of the best strategies that you can undertake to reduce your risk of complications